Holi. Happy Holi and happy Women's Day. And thank you for joining us today during your holidays. And but I'm sure that you all will enjoy today's session. This is going to be a wonderful session. And now I hand over the session to Dr. Rupinder Dior, the chairperson for today's presentation.
Thank you, ma'am. Good evening, everyone. At the outset, I would like to welcome the organizing chairperson for this online course, Madam Dr. Samriti Arora, Principal College of Nursing, organizing secretary, Dr. Xavier Belsiel, ma'am, and speaker for the day, Miss Cecilia, madam, and all the delegates for this day 3 of the online course on nursing education, measurement, and evaluation. In the previous 2 days, assessment skills like OSCE, OSPI, preparing and scoring checklist, and the types of assessment, that is formative and summative assessment, has been discussed. And today, another interesting and very important topic related to measurement and evaluation, which is assessing knowledge. Preparing multiple choice questions will be discussed by our eminent speaker of the day, Ms. Cecilia Mary. I would like to introduce Madam to you. Let me share my slide. Yes. Madam is Associate Professor at College of Nursing, AIIMS, New Delhi. Ma'am is also the National Trainer in Neonatal Resuscitation, National Trainer for Breastfeeding course, Infant and Young Child Feeding course, as well as E-Preterm course. Ma'am is part of the team for WHO project in non-communicable diseases in Southeast Asia region. Ma'am is also a simulation trainer. Ma'am has received various awards to her, out of which she has also received the Best Teacher Award from Indian Academy of Pediatrics. Ma'am has been resource faculty for several universities in several conferences also, and ma'am has several publications to her credit. So without wasting much time, I would like to welcome ma'am to start her session. Over to you, ma'am.
Thank you, Dr. Rupinder Diol. Thank you, Madam Principal, and also Madam Elsie for this opportunity. Now we'll start with this session. Ma'am, can you see my slide?
Yes, ma'am, your slides are visible and you are audible.
Okay, good. So in today's session, we are going to see assessing knowledge and preparing MCQs. Actually, knowledge, as you all know, like education is only change in behavior. Change in behavior is obtain or how change in behavior occurs. It occurs through acquiring knowledge. So knowledge is acquired through various means. Like example, I would like you to participate, all of you. You can unmute and you can talk also in between. So the various sources of acquiring knowledge, by books we acquire, by the skills that we learn, by studying the resource materials, answering, teaching, education, and there are different ways. Even communication with our teachers or juniors, or communication with the patients gives us a learning experience. It helps us to acquire the knowledge. So the assessment of knowledge is based on the Bloom's taxonomy of objectives. I think tomorrow's session will be on this. So I'm not going to elaborate on this, just to give an overview of it. The Bloom's taxonomy of objective has three main things wherein Bloom says it as cognitive, affective, and psychomotor. Cognitive component is the knowledge component, and it is categorized into again 6. It is divided into 6 parts like remember, understand, apply, analyze, evaluate, and grade. In further slides, we will see how we are going to. This is the basic, the objective of the entire curriculum or the learning experience that is planned for the student is being planned according to the Bloom's taxonomy. For knowledge component, these are the 6 divisions under which we discuss. So knowledge assessment as such, knowledge assessment, the word knowledge assessment is always referred to as didactic test, which is in Slovak and Czech also. There are a lot of articles on this, and they have studied a lot of things. Like in 1975, they have written papers on this didactic text, how to assess knowledge and all that. And also achievement test is also another term that they use. Okay, it is a systematic measure. The assessment of knowledge is done to systematically measure the results of learning. So that is the aim of assessing the knowledge. So why to assess knowledge in education? Is it necessary? Participants? Is it necessary to assess knowledge?
Yes, ma'am.
Yeah. So here, like curriculum, when we see, curriculum is what we want the students to acquire. The curriculum is planned in such a way that the student is getting exposure in all the planned ways. Okay, so in order to implement the curriculum, teaching is done so that the desired knowledge, the knowledge that is to be acquired by the student is delivered by means of teaching. And this teaching, whether it has reached or not, whether the student has acquired the knowledge or not, is done by assessment. Okay, this assessment, it is a cyclical process. See, assessment is done to implement the curriculum and also teaching. The gaps are identified and again addressed. So it is a cyclical process, and it is a two-way process where how the curriculum is implemented. So assessment of knowledge becomes vital during the process of implementation of the curriculum. So methods of assessing knowledge, when we see, there are two different methods, like we have direct methods and indirect methods. Direct methods are the tests that we have, the didactic tests that we have, the concept maps that are created, like when the student is made to understand the situation and they are able to perform the things. Then portfolios, that portfolios are the exposure of the student, how they are exposed, what are their learning experiences. We have the logbook as portfolio for a nursing student. Then auditions in the sense like the presentations that goes at the end of your MSc nursing. You are expected to attain this teaching skills, all that. So these are auditions, your case presentation, all that are also direct methods of assessing the knowledge obtained. Indirect methods, when we see the self-report that you submit and the inventory and the prior experiences that a person holds, all these are indirect methods of assessing the knowledge of a person. So as the next part, I'll come to uh, preparation of MCQs. Okay, when we take MCQ as such, what are the parts of an MCQ? The first is the stem. The stem is the question or statement that presents the problem or issue being addressed in the question. Okay, we will discuss in detail in the coming slides. So stem is the statement which presents the problem to the student. Okay, the stem should be self-sufficient, like the student should be able to understand the problem that is being addressed. Then options or choices. Options or choices are the possible answers for the question. The option should be mutually exclusive, collectively exhaustive, meaning that only one option is correct and all other options should be incorrect. This is very important. See, for example, for MCQs, we will have 4 choices, sometimes 5 choices or 6 choices. Whatever is the choice, it should be mutually exclusive, or in certain types, we have more than one correct answer. So according to the type of MCQ that is being formulated, the option or choices should be kept. Key is the correct answer to the question. Okay, it might be 1 or 2 as per the thing that is being formulated, the MCQ that is being formulated. Distractors are the incorrect options that are used in the question to make it more challenging, and also it helps the student to guess. Distractors should be plausible but clearly incorrect. Plausible, it should be like the student should be distracted. It is not a correct answer, but it is the student has to be distracted in such a way that they are, until and unless they have the desired knowledge, they will not be able to answer the question. Example for this: at 5 minutes after birth, the Apgar score of a newborn is 9. What does this indicate on the condition of the newborn? Any answer? Anyone from pediatrics, OBG? At 5 minutes after birth, the Apgar score of a newborn is 9. What does this indicate on the condition of newborn? So here, the stem is like at 5 minutes after birth, the Apgar score of the newborn is 9. So what does this indicate on the condition of the newborn? This is the stem. And you have, when you see Apgar score, you have normal, mild, moderate, severe. Okay, these are the plausible distractors. 9 is normal, but the plausible distractors are mild, moderate, and severe. These are classifications of the distress that we see as per the Apgar scoring. So these are the distractors that are used. Okay, further we will see. So characteristics of a stem as such, when we see, it should be clarity. The stem should be clear and concise with a single concept that is easily understandable. Even this question, I would have made it in an easy way. Like the Apgar score of a newborn is 9. That indicates. Okay. So it is the way that we formulate. And we will see relevance. The stem should be relevant to the topic or subtopic that is being tested and should address important information or concept critical to the understanding of the material. A student who has completed third year BSc nursing or doing fourth year should be able to know about Apgar scoring. Okay, so when that is the objective, the stem should be relevant enough that they are able to assess the knowledge or the information regarding the concept. The stem should be complete in itself and should have all the answer choices to provide context or clarification and should not depend on the answer choices. The stem itself should address the problem. It should not depend on the other choices that are given to understand the question. Okay, grammatically correct. That is very important. This stem should be free of errors so that the students can focus on the content rather than questions, rather than parsing in its language. Okay, so it should be grammar should be correct and it should be clearly understood. The stem should be unbiased and free of language errors that might lead students to answer one or the other. Okay, it should be clear, no bias in the language. And stem should be consistent with the other methods of assessment in terms of level of difficulty, language use format also. It should not be varied. Like, for example, certain questions, entrance exams, they differ in languages, but it makes a different meaning with different language. So it should be very consistent. And even when the questions are asked in the same language, it should be consistent that it addresses the problem. There should not be any bias in the question that is being formulated. Example, like at 5 minutes after birth, the Apgar score of a newborn is 9. This was the question that I showed you before in the previous slide. Okay, what does this indicate on the condition of the newborn? Okay, the stem can be remodified as an Apgar score of 9 in a newborn at 5 minutes indicates. At 5 minutes, an Apgar score of 9 indicates, or an Apgar score of 9 in a 5 minutes old newborn indicates. So what do you think? Which one is more appropriate? No one. Okay. So these are the different ways. Only one stem. And does this second one, an Apgar score of 9 in a newborn at 5 minutes indicates, does this convey the same information?
Yeah, yes, ma'am. Second one does indicate, I.
Okay. So at good, thank you. Thank you for answering. Okay, so there are different ways. It is the objective of the preparation of MCQs is like it should be short and clearly understandable. Okay, so you can see a difference in language in all in all the four. So which one is appropriate? It it should be as a standalone statement. The problem should be understandable by the reader or the student who is attempting. So it has to be properly reviewed. Okay, so a STEM is overall a well-written STEM is the foundation of a good multiple choice question and should be crafted with care to ensure that it accurately reflects the knowledge and the skills being tested. Okay, so this is the characteristic of STEM. Then coming to the distractors, we had distractors like plausible. Distractors should be plausible and reasonable choices. Here, when I say that the UPCAR score of 9 indicates normal, mild, moderate, severely depressed. Instead of that, if I put like indicates respiratory distress syndrome, meconium aspiration syndrome, indicates hyperbilirubinemia, will that be an effective choice?
No,
Those are not
ma'am.
plausible distractors. Okay, so plausible distractors are essential to ensure that the question is challenging and also it requires the student to engage in the material in order to choose the correct answer. Okay, so it is like not easily detected by the student. The student should understand the question and they should know the basic concept so that they can understand. Okay, and relevant. Distractor should be relevant to the question stem, address common misconceptions or errors that students might make while attempting to answer the question. For example, for the same question, if I put an APGAR score of 9 indicates mild distress and also indicates respiratory failure, heart failure, all these are irrelevant. And so it is easy for the student to pick out that it is normal. Okay, APGAR score, they know 10. So 9 might be normal. So it just goes on fluke. So that should not be there. So ideally, the distractor should be relevant, somewhat related to the question stem. Then grammatically consistent. Distractors should also be grammatically consistent with the stem and the correct answer choice. Okay, so it is like, it should not be like the answer choice of one distractor. The distractor is a small word and the other one is a lengthy sentence. That makes it more critical and it does not address the engage the student to think and answer the question. So the students are not able to uh, address them based on the syntax or grammar alone. So it should be grammatically consistent and unique. Distractors should be distinct from each other and from the answer choice. For example, I have a question in the further slides. To see the incubation period of mums or something, it is given in different sources differently. You have many books. Okay, when you see Park, it will be like 5 days, 10 days, 5 to 10 days. When you see Google uncle will give you like 2 weeks, like that. So it will be different. So when you put all this, it will be confusing for the student. And you have different sources of information and different books give. So such type of distractor should not be used. And the students may should know that it is different, distinctly different from each other, the choices. So that students must carefully evaluate each option to answer which is the correct answer. The distractor should be roughly equal in complexity and also plausibility. This helps to ensure that the students are able to eliminate or select option uh, solely on its length or complexity. So it is like they cannot eliminate or select option based on the length or complexity of the distractors. So it should be equally balanced in the sense of the length of the statement. Everything should be more or less equal so that they are able to they are just like that. They cannot easily do it. With their knowledge acquired, they will be able to complete it. Then appropriate for the level of difficulty. See, even questions, MCQs, when we formulate, we have certain set criteria. whenever an MCQ is formulated for a competitive exam, it is like 50% is always easy to answer. 30 is little tough, and the 20 is the most difficult, or the vice versa also it happens. So depending on the difficulty index, the questions have to be set. So that, and the distractors are very essential in this aspect. For example, reliability and validity. If we formulate the question in such a way, it might be confusing for the students to answer. Until and unless they know the appropriate knowledge, they have the appropriate knowledge, they will not be able to answer the question. Overall, good distractors are an essential component of a well-designed multiple choice question. They should be crafted with care to ensure that they are relevant and also challenging, and that they require students to engage in the material in order to select the correct answer. So this is an essential component of distractor. So now we will see what are the tips or how to prepare MCQs. First of all, to prepare an MCQ or multiple choice question, we should understand the concept. It is very essential that we have a good understanding of the concept or the topic that we are going to prepare MCQs on. So relevant text has to be read, taken notes, or review of key terms has to be done, so that we are able to prepare a proper MCQs. Then break down the question. See, divide the question into small parts and then try to identify the correct answer, and then distractors also. This can help you understand what type of information you are going to include in each answer option. So it is always essential that we break down the question. What are we what is the intention of assessing the knowledge? If the objective is the student should be able to understand hyperbilirubinemia. So hyperbilirubinemia, what are the different concepts? So how am I going to assess? So in that, what and all things can be assessed by using an MCQ or the other methods. Okay, that is the entire meaning. Then write clear and concise questions. Write questions that are clear, concise, and also easy to understand. Make sure that the wording is clear and avoids ambiguity. That is very important. It should not be ambiguous like this or that, and it is always may or may not be. Not that those types of questions cannot be asked. Write plausible distractors, as we saw. The goal of MCQs is to test the knowledge. So it is important to include plausible distractors. That is, plausible distractors are the ones which are incorrect answers that are very close to the correct answer, but not correct. Okay, but not right. So we should write the plausible distractors. Avoid leading questions, like try to avoid writing or giving answer in a wording, like which of the following is not a type of fruit. So it is like easy question for example, which is not a nursing activity to be done. Okay, so all these questions are leading questions. So we will not use those leading questions. Use images and diagrams. If at all appropriate, we should use diagrams. See, for example, you want the student of second year to know the types of cannula, and you want to assess that. So you are keeping, instead of saying in sentence, put a cannula, and the question is, what is the purpose of this, or like what is the size of this cannula? So that it will be more appropriate for the student, or type of stool that comes in hypobilirubinemia. So in that, if you put a picture, then the student will be able to. So wherever images and diagrams are required, it should be used, so that it makes the question more engaging for the students. Okay, use a question format. See, for example, the causative organism of leprosy is, which organism causes leprosy? So experts say that it is better to use question format rather than statement format for in an MCQs. Okay, and also use only a single clear defined problem and include that in the question. Okay, multiple problems should not be included. So, and also it should be encouraging for the students or for the addressee to have higher order thinking. So based on the objectives, we have to formulate And what is the difficulty index? We have to make the student to engage in higher order thinking. Keep options length similar. This is very important. We have already seen the options, all the options should have similar length. If one is long and one is short, then it is going to give a lead for the student. Balance the placement of correct answer. Like for example, when we have options A, B, C, D, E, always we should make it that all B's are not correct or all C's are not correct, or following a pattern of A, B, C, D, and then again D, A, B, C. That gives a lead for the students and they will do hinky pinky ponky. So it's better we have to balance the placement of correct answer also while preparing an MCQ. It is good to always avoid negative questions. Okay, and clear instructions should be given for questions. Okay, if you have two or more choice correct answer, then appropriate instruction has to be given so that the student is able to select two or more. Okay, and certain times like we give in case of IMNCI. If a child comes with these problems, what are the course of action? So we tell them to order it, okay, to number it like 1, 2, 3. So in that case, we have to give clear instruction to the students so that they understand the question and they do what is expected out of them. And always avoid all the above and none of the above option, because it is like many a times what happens, all the above options, students tend to go for this option. Because without even knowing what is the correct answer, they always go for that. None of the above is also, it is not a plausible distractor for the students. Okay, next we will see the type of MCQs. Okay, there are different types of MCQs. We will see what are the different types and what are the advantages and disadvantages with the examples. Okay, first one is single select MCQs. Then we have multiple select MCQs. We have true or false MCQs, matching and fill in the blanks, and also sequence MCQs. We will see first what is single select. Here, these are the most common type of MCQs that we use. Here, the participant or the person who takes the test is always asked to select only one answer from the list of options. For example, the first step in IMCA case management process is you have, these are all the steps of the IMCA management process. But here we have only one correct answer, that is assessed. Okay, so this is single select MCQs. The advantages of this is can assess a wide range of knowledge and skills. Single select. Okay, and also it provides a clear picture of the test taker's overall understanding of the concept. Okay, the disadvantage of this is it may not accurately reflect higher order thinking skills. Okay, the single select. Single select also you can make higher order thinking skills, which we will be seeing later. And this may not be able to distinguish between the different levels of understanding of the student. May not test the test taker's ability to explain or apply the concept. This is a different angle. Okay, so ability to explain or apply the concept is not a single select MCQs, which will be intended to assess. Then the next type is multiple select MCQs. In this type, the test taker is required to select more answers from a list of options. This type of question is used to assess higher order thinking skills and also complex knowledge. Agents that cause disease are, like there are different agents. So here more than one is correct, nearly 4 are correct. So it is like, it makes them to think higher. You can make it a little complex also. There is a simple question that I have put. So the advantages of multiple select MCQs are can assess higher order thinking skills, can test the test taker's ability to recognize and analyze multiple concepts, can provide a more comprehensive picture of the test taker's understanding also. Disadvantages like maybe more time consuming and difficult for the test taker to comprehend, maybe more difficult to grade and score accurately, may not accurately reflect the test taker's ability to prioritize informations and make decisions. Okay, it is like 1, 2, 3. You are giving 3 options, so they need not prioritize. They can only simply say these are the things. So this part of it is left unaddressed. Then true or false MCQs. In this type, the MCQ, the test taker is required to indicate whether the statement is true or false. For example, unemployment is a handicap, whether it is true or not. Okay, we have different types. What is impairment, disability, handicap? As such, as per unemployment is a handicap. So you have to mark true. So this is how you are just defining whether the statement is true or false. The advantage is it is easy to administer and score. Whether true or false is very easy to score. Can assess a wide range of knowledge and skills, whether they actually know what is handicap. Okay, and whether they know the different types of handicap. Okay, can provide a clear understanding of the test takers, understanding of the specific details of the concept. Okay, the disadvantages are it may not accurately reflect the test takers' understanding of the complex relationships, may not allow for partial credit. Okay, here only yes or no. If it is correct answer, we are going to give full mark. If it is wrong, no mark. Okay, so it does not allow for partial credit, may not distinguish between the different levels of understanding. If they know it is well and good, if not, it is like, yeah. So different levels of understanding is not needed in such types. Here, matching MCQs is, it is like match the following. Match the following, the test taker is required to match the items from the other column. This type of question is used to test the definitions and relationship. Here, where I have three, like Q fever, scrub typhus, and yellow fever. So it has to be matched with a causative organism, like flavivirus or Coxiella rickettsia. So this is how it is made. So here the disease and the causative organism. Likewise, we can have different relationships that can be done. Okay. So advantages of matching MCQs are it can assess the understanding of relationships and connections between concepts. It can provide a comprehensive picture of the test taker's understanding, and it can also be used to assess both recall and application of information. The disadvantages are it is more time consuming and difficult for the test taker to complete it. Okay, and may be difficult to grade or and score accurately, may not accurately reflect higher order thinking skills. Yeah, of course, higher order thinking skills are not assessed using matching MCQs. Fill in the blanks. Here, the test takers are required to fill the correct answer in the blank from the list of options. Here, this type of questions is used to test recall of specific information, like vitamin A deficiency results in. There are 1, 2, 3, 4 options, or else the student should know what is it. The definition of nursing. Nursing is a unique function of a nurse is to assess sick or well, all those. Okay, so these are the fill in the blanks options. So the student should know the information so that he or she can fill in the space. Advantages is can assess recall of specific information, can be used to test the test taker's ability to apply and use information, and also it was a useful tool for testing vocabulary and also terminologies. Disadvantages, it does not accurately reflect the test taker's understanding of more complex concepts. It may not distinguish between different levels of understanding and may not allow for the partial credit. Only when correct answer is written, it can be. See, for example, gentian violet of applied for oral thrush. The concentration of gentian violet to be applied for oral thrush is dash 0.25 or 5% whatsoever, 2.5%. It is, if the student knows it correctly, the student will get mark. Otherwise, no, it is wrong. Then sequence MCQ. In this type, the test taker is required to order a series of items. Like this type of question is used to test the understanding of sequences of chronological order. Like for example, at Moni, a 24-year-old primary mother, the baby did not cry immediately after birth. So what steps should be done first? What to be done second? So there can be 5 options that are given, and it can be the student, the test taker can be told to number the items according to the priority. Okay, so this is called as sequence MCQs. So the advantage of this is it can assess the understanding of the sequence and process. For example, the other one was an example of the neonatal resuscitation algorithm. So by using sequence MCQ, we are able to understand whether the student knows the algorithm as such or not. Can be used to test the test taker's ability to recall and also apply information, and also provides a comprehensive picture of the test taker's understanding also. Disadvantages is more time consuming and difficult for the test taker to complete it. May not accurately reflect higher order thinking skills, because it is like their understanding is only checked. They have to know the order. Neonatal resuscitation, what they are going to do. So that was only assessed. This also may not allow for partial credit, but it can be tried. Okay, so these are the different types of MCQs. Now, coming to initial slides, we were seeing about Bloom's taxonomy of objectives and how. So now we will see how are we going to have address our MCQs to assess each part of the Bloom's taxonomy. Like for cognitive, the knowledge domain, how are we going to assess? See, for example, knowledge. The first basic level is knowledge. Knowledge is to recognize or recall information. In this type, we can always have like chicken boxes transmitted by. So here we have 4 options and it is only a knowledge. If the student knows, then they will be able to answer this question. Okay, comprehension. Are they able to use the knowledge that they have acquired? Okay, demonstrate that the student has sufficient understanding and arrange material mentally. So, for example, in this, which of the following teaching methodology can be best used to teach IV line insertion for a first year BSc nursing student? Okay, so here the student has learned the different methods of teaching and learning. Now the student is going to comprehend which will be appropriate for teaching the specific topic. Okay, so this is to assess the comprehension. Then application part. A question that asks students to apply previously learned information and answer. See, for example, a third year student is being taught Holiday-Seger's formula and they are asked to calculate. So here, given the information about the child, the knowledge that they have learned is being applied to calculate the fluid requirement. Okay, this is to assess the application of the knowledge acquired. Okay, hope you all, any doubts so far?
No, ma'am.
No, ma'am.
Okay. Analysis. Here, analysis is a higher order question that requires students to think critically in depth. Okay. Here, when we see this question, a 65-year-old male patient presents to the emergency department with shortness of breath and chest pain. He has a history of smoking and high blood pressure. The nurse suspects that the patient is experiencing a myocardial infarction. Which of the following diagnostic tests is more appropriate for confirming the diagnosis? Say which is the one, like here, complete blood count, electrocardiogram, chest X-ray, MRI. So here it gives an opportunity for the student to think and answer. Okay, they should have in-depth knowledge about myocardial infarction. What are the diagnostic tests for that, so that they are able to answer this question. Okay, here it is like ECG is the ideal answer. Why? Because there are so many reasons and we have to know what is the ideal one and why it has to be done. Okay, then synthesis. For this it is also a higher order question that asks the students to perform or to have a creative thinking. Here, when we see the question as such, a 75-year-old female patient is admitted in the hospital with a diagnosis of heart failure. 1 minute. Diagnosis of heart failure. She has a history of hypertension and diabetes mellitus. The healthcare provider orders several medications to manage her symptoms. Which of the following medication combinations requires the nurse to monitor the patient's electrolyte levels closely? Here we have, see, furosemide and spironolactone, metoprolol and enalapril, digoxin, warfarin, amlodipine and aspirin. Here the student should understand the disease condition and also the different medications. Then only the student will be able to answer. So this is synthesis. The knowledge that they have acquired, that is going to use. Okay, here furosemide. So the other distractors are ideally equal. So that, see, here the stem, The stem is very much explanatory by itself, and the distractors are more or less similar. Nothing is, and all are drugs. So it gives it it is a plausible distractor for the test taker, which they have to use their knowledge to and identify the correct answer. Okay, evaluation. This is also a higher level question that does not have a single correct answer. See, for example, this question. A nurse is caring for a patient who is receiving blood transfusion. The patient develops shortness of breath, wheezing and hives shortly after the transfusion begins. The nurse recognizes the patient is having an allergic reaction. Which of the following actions should the nurse take first? Here, see, administer epinephrine and stop transfusion immediately and notify the healthcare provider. That also can be done. Administer epinephrine and Benadryl also. Document the patient's symptoms and vitals. This has to be also done. Notify the blood bank and return the remaining. All these can be done while something happens during. But which is the first action that the nurse has to take? Okay, that is evaluation. So it will be stop the transfusion and notify the healthcare provider will be the appropriate option. So here, if the student is not able to, doesn't have the knowledge, they can either write administer epinephrine, notify the blood bank. So here, even before notifying the blood bank, it is very essential to stop the anaphylactic reaction. So for that, the nurse has to stop the transfusion immediately and then notify. Okay, so these are ideal distractors, plausible distractors for the question stem. Okay, so now we have seen all about MCQs, the different types of MCQs, and also there are different tips to formulate MCQs. Now, I want all of you to say that whether it is like these are correct MCQs or wrong. And if it is wrong, what is wrong? Okay, so I think you can switch on your videos. You can unmute yourself and you can answer. See, when a person is exposed to a pathogen, by which of the following routes, the individual is at risk of getting tuberculosis. Here, the options are droplet nuclei, blood droplet. Is this a well-formulated question? Yes, Priyanka.
I don't think so. The question
Yes.
is well formulated, ma'am, and mainly the stem. The question is not adhering to the stem. I feel like.
So how can it be formulated? You understand? You understood what is it?
Yes,
Very
ma'am.
well. Is the stem understandable for you?
It's like quite tricky. The main part of the stem is not understandable. I feel like.
Okay, then coming to the distractors.
Droplet infection and droplet nuclei.
Both are
Almost same.
almost same. Yeah. Here, when you see here, both the stem and the options are not correct. Okay, when a person is exposed to a pathogen by which of the following routes, it is very it is not the mode of transmission of tuberculosis might be an ideal question rather than so much of explanation. Okay, is it
Yes.
okay?
Yes,
The
ma'am.
mode of transmission of tuberculosis might be here. When you see the options, distractors are not plausible. Okay, I have put like droplet nuclei and droplet infection, sputum. All these, even sputum is also can transfer through droplet nuclei, right? So it can also be a droplet. So the options are not plausible and it does not have a one correct answer. Okay, whereas I have put the instruction like choose one correct answer. Each question carries 1 mark. Did you read the instructions? So
Yes,
the
ma'am.
instructions and the options are not matching, whereas my stem is also not appropriate. Okay, my stem is too much lengthy and it is confusing. Okay, when a person is exposed to a pathogen, by which of the following routes? So all this is, there is no route that I have mentioned. Okay, but it is a mode of transmission of tuberculosis, right? So this is not an ideal way of formulating an MCQ. Did you all get it?
Yes, ma'am.
Yeah, good. Next one. The incubation period of measles is 11 to 12 days, 10 days, 14 to 17 days, 10 to 14 days. Yeah, now tell me.
Ma'am, option A and overlapping like 10 to 12 and 10
We'll
to 14.
discuss. The incubation period of measles is the stem correct? What
Yes,
do you
ma'am.
think about the stem? Stem
Stem
is
is
correct. Huh?
Yeah, stem is correct. It is like direct
You are able to
okay,
understand standalone stem. You can understand
standalone
the
stem.
problem
Yes.
that is being addressed. Good. Okay, come to the options.
And the options are inappropriate. All
Mm.
the three except B, all the three are giving a range of days, and except B, it is only pointing to a single day, only single
Mm.
option.
Mm. So it is not a plausible distractor. Okay, here there are, see, 10 to 14 is there, 14 to 17, but in between 10 to 14 there is one 11 to 12 also, there is 10 also. So these are not plausible distractors. Oh, sorry, these are not plausible distractors. And also, in such type of question, there is always a problem. Different books give different informations, and if you put this question for an MCQ to assess knowledge, see, in Park, K Park, 26th edition, the incubation period of measles is 11 to 12 days. Okay, but when you search Google, it comes as 14 to 17 days. Okay, in some other book, there may be some other information. Okay, so such type of question where you have different answers in different sources. Okay, such type of question has to be avoided. Okay, and the distractors are also not appropriate, as three are in range and the ranges are also not. See, if at all, if I have a range of like 10 to 12, 12 to 14, 14 to 16, 16 to 20, it is somewhat in order. Okay, but it should not be contradictory. Okay, so that has to be kept. So this, in this, the stem is correct and the distractors are all not appropriate. Okay, do you agree?
Yes, ma'am.
Hmm.
Yes,
Okay, now you are the boss. Now you are going to formulate an MCQ with this information that is given. Help me. One of you can formulate, one or all of you can try. See, there are two types of information. It is from the concept of occupational disease, and this is from Park only. In occupational diseases, pneumococciniosis is also a type, and also silicosis is a type of pneumococciniosis. Okay, here what is pneumococciniosis? I have given the information, and what is silicosis? You can formulate multiple MCQs using this given information. So please do try, and we'll discuss. You can try. Anyone? Any? You can even type in the chat box. Disease caused due to inhalation of silica particles are called. Okay, what are the options? Good. Dust within 0.5 to 3 micron can cause. Good. So here, disease caused due to inhalation of prita. It can also be written as an occupational disease caused due to inhalation of silica particles. Yes. Or which occupational disease is caused due to inhalation of silica particles? For this, the distractors may be? What may be the distractors? So it can be like silicosis, anthracosis, bicyanosis, and all this can be, okay, there are different. Okay, dust within can cause, yeah. Dust within 0. This might be an incomplete stem, okay. Instead of that, the health hazard that is caused by the dust within the range of this is, okay, or which health hazard is caused by a, yeah, silicosis caused by, good. Good. So I'm not able to. Silicosis caused by. Oh, I missed it. Silicosis caused by mud dust, silica particles, inhalation of. It is smoke. I hope so. It is smoke, grain dust. Okay. Good. So now, did you all understand the how to formulate the stem? What are the different types of MCQs, and also how to formulate the plausible distractors? So now let's discuss any doubts, any clarifications. I would be happy to answer you.
Ma'am, I have a question. While preparing MCQs, if we take a certain topic and we want to prepare for that MCQs, can we use the different types of MCQs in one single for one single topic, or
Yeah,
we have to
actually,
stick to only one type of MCQs for a particular topic?
see, actually, the intention or the objective of you preparing MCQs, if it is to address knowledge, assess the knowledge, like for example, you are having a BSc student and you want to assess after your class, after your seminar, or after your 1 hour teaching class, you want to assess. Okay, which one you would like to choose? If you are teaching on neonatal resuscitation, then you can have a sequence MCQ and also a one answer MCQ. Okay, so it is on the objective that you are going to assess. You have to formulate your MCQs. It is not mandatory that you will have only one type. But for exams, okay, it is all 1 mark question. Okay, but we take for IMNCA, we take a different type of exam wherein we have true or false, we have sequence MCQs, we have fill in the blanks, everything in one answer MCQs. So you can use according to the objective, whether you are going to assess a higher order level of thinking or a lower order, or only the knowledge that you are going to assess, you can formulate. There is no clear mandate that you should use only one type of MCQ to assess knowledge. Okay, I think I
Yeah, yes,
made,
ma'am. Thank you. Thank you so much.
yeah. Yeah, others, please.
Yeah. Any other doubts?
Ma'am, in between my net got disconnected. Can I know why this none of the above and all the above options are not used? Yeah. None of the above and all the above options. See, all the above options, almost it takes into a preconceived notion that the student, without even knowing the answer, they will put all the above. Okay. And none of the above is not a plausible distractor. Why? Because, see, it is like saying nothing is correct. So it is like when they read and if they feel that they are not correct, they just go for the none of the above. It doesn't give the exact understanding of the knowledge of the students. So we always try to avoid all the above and none of the above option. Okay, all the above is always a lead for the student. We give 1, 2, 3. See, for example, the causes of occupational hazards are 1, 2, 3. All the three may be correct. So we give all the above option. So without even going for the third option, whether it is correct or not, when two are correct, this student will go to the last option, which is all the above. So they do not have an understanding of what is the other three. Okay, without even proper understanding. That is why we say that to avoid all the above and none of the above options. But it is not always, like sometimes rarely you can use, but not always.
Okay, thank you, ma'am.
Welcome.
Ma'am,
Any more
there is-
questions? Yeah.
Ma'am, there is another question in the chat box. What is assertion and reason method?
Assertion and reason method is like you have to understand if a problem is given, the student has to understand and they have to reason out why it is done. See, for example, the STEM is like at 5 minutes when the newborn baby is not breathing, start with at 3 minutes you start with chest compressions. So why is chest compression done is a reasoning method. They have to understand the question and they have to reason out. Even in the analysis, synthesis and evaluation part, I was discussing the same. It was the student has to assert and then reason and then answer. Okay, so this is the method. Hope you got it. It is a higher order thinking as assessment.
And one more question, ma'am. When
Yeah.
I was browsing through the knowledge questionnaire for assessing the knowledge level of diabetes, many projects has given like yes or no options also for the knowledge questions.
Mm.
So is it right to have a yes or no questions for a knowledge assessment?
Yeah. See, knowledge assessment, it depends on the population that you are addressing to. If you are addressing a patient, if the knowledge is assessed for a patient, then you need them to have only simple understanding of what is the concept. So yes or no type addresses. But if you are doing the same assessment for your BSc students or an MSc student, though you will have assertion and reason type more rather than true or false. But for a BSc student, these are statements. You want them to know the statements, yes or no. Only that. So it is a simple understanding that you are going to assess. Okay, so it depends on the population for whom you are addressing. For a common public, we are teaching and we want them to know. We will not use reasoning questions. We will not use analysis question. We want them to know only yes or no, whether this is correct or not correct. Okay, so in that cases, so nothing is correct, nothing is wrong. It depends on the population that you are addressing and the intention or the objective of the assessment that we are planning to do. Hope.
Okay, ma'am. Thank you.
Yeah. Welcome.
Any more doubts? So I think we can wind up the session. Thank you so
Yeah.
much, ma'am, for
1
such
minute, 1 minute, 1 minute.
Okay, ma'am.
I have a few take-home message. Like,
Okay,
see, to
ma'am.
prepare MCQs, we have to master content before even preparing MCQs. And clear step with plausible distractors and a clear key is always essential for preparing MCQ. And prepare MCQs based on the objective that it intends to assess, as we were discussing. Okay. These are my references. And thank you all. Today, Holi is a celebration. Instead of the celebrations, all of you were very attentive and participative in the whole session. And also, I thank the organizers, Dr. Smriti Arora and Madam Dr. Xavier and also Dr. Rupinder for moderating the session. And thank you all for the opportunity. It was nice interacting with you all. Thank you.
Thank you, ma'am. Thank you for the wonderful, knowledgeable session, actually.
Thank you, ma'am.
Okay.
Thank you, ma'am, for
Thank
the
you.
wonderful session. You have explained very nicely about the knowledge assessment and the different types of MCQs, the parts of MCQs, how we can do knowledge assessment through Bloom's taxonomy, and the aim of assessing the knowledge, why we need to assess the knowledge, and then the characteristics of different parts of MCQs. And the best part was the examples with which you have tried to explain this thing, and you have made it so easy. And the students were also fully involved in the session, because you had given them exercises in between the session to keep them alert. Thank you so much, ma'am, for the wonderful session. And now I hand it over to our principal, ma'am.
Thank you so much. Thank you, Cecilia ma'am, for the very insightful session and for keeping on engaging the students. And I think the students have learned a lot of new things today. And thank you for coming on Holi and on holiday and sparing your valuable time with us. And we hope to see you again soon. And thank you to Eco India and all the participants. And I must appreciate the participants are very good and they're asking very good questions. I'm very proud of you. And be ready for tomorrow also. Okay. All the best. Happy Holi.
Yeah.